Any questions, any doubts, please go ahead. And we are going to be doing this is a series of lecture, and I think somebody's mic is on.
I think Chris Robert has raised his hand. Yes, please, Chris, go ahead.
Yeah, go ahead.
Yeah, Doctor, I have this question for you. One of my friend and his daughter, she gets this sudden kind of an attack, whether it's an evil spirit or I don't know, but there is this feeling that she gets that some kind of a energy or strength within herself, and she starts acting little differently. And this happens only when the father is not there. And I don't know, she gets that immense power in herself. And then afterwards, and she will talk to her mother in a very different tone, in a different manner, and commanding and all that. And when father is there, she is normal.
So
what could be the reason?
Yeah, so because I haven't seen the child, I can't comment about the diagnosis, but we see this quite common, and we call this as dissociation or possession-like syndrome. Now, what happens is our body responds to stress in different ways. So if there is something that is causing me anxiety, I can have a fight response, I can have a flight response, or I can have a freeze response, where I completely shut off. And sometimes in one of these responses, we react and respond in a particular way, right? It's also something we call as a conversion disorder, where my emotional stress, my emotional anxiety is getting converted to a physical problem. So we have to address what is this anxiety, what is this emotional problem, and there could be multiple reasons of why that behavior is happening in certain situations and not happening in certain situations, right? So this child needs to be seen by a mental health professional and not just look at it from the spiritual angle. See, spirituality and prayer and faith are great. I'm a practicing believer, but I feel that God shows us the way. And if you're not going to take the way and just fall back on, saying that this is just a spiritual concern, then we are doing a great disservice to that person.
Yeah. Right.
Thank you, doctor. Thank you, doctor.
Yeah. We can always see God as the one who also created medical science and have both approaches together. Yeah. Okay. Anybody else?
Yeah. Can I ask a question? Yeah.
Ishita, go.
Okay. So a lot of times stress is manifested in various ways, stress. So stress can also cause, you to have a fall. Stress can have a lot of physical problems, and so how does one differentiate, or when does that stress kind of overtake and get into a mental problem? Because and stress, the reasons of stress are, of course, the interactions or whatever you're going through, your maybe at the pregnancy time, whatever is happening in your body or in your personal life or official life. So this is a big differentiation problem.
Yeah. So see, stress is something which is going to be part and parcel of all our lives. We don't live in sanitized, perfect environments, right? Now, there are various aspects to this. So stress is part of life. Any change in my environment is going to be perceived as stress by me. Now, there are a lot of factors to how I will. So in the same situation, somebody will react in a different way and I will react a different way. So my genetics, my predisposition to how I will react to stress, my resilience, that means the way I have coped with stress all my life. What are my learnings? How I have handled difficult situations right from the time I'm a child is how I'm going to respond to that environment. And many a times in situations, we cannot change the environment. If I have a difficult work environment, for example, just give you an example of a difficult work environment, and I can't leave my job. I have to get up and go every day to work, but the environment is very, very toxic. Till I get another option or a way out from the job and I have to go, we have to teach that person skills to manage that stress better. And there can be so many skills that we teach them. We kind of help a person to build some reserves, some positivity outside that stressful environment. A lot of focus on physical health, sleep, a lot of cognitive behavior therapy. In stressful situations, the stress management is where therapy really comes into play, where we teach them the skills of how to cope with difficult situations. But if the stress is ongoing for a very long period of time, and if the stress is causing changes in mood, changes in thinking, and changes in behavior, then it's almost bordering on depression, or it leads to depression, and that must be intervened with the help of a psychiatrist.
Yeah, okay, thank you.
I have a question. Uh, there is a youth who has a background of sexual abuse, anxiety, and presently she had a breakup almost after 6 years of a relationship, and this relationship became little intimate also. But after the breakup, she is having a lot of suicidal thoughts and a lot of thoughts, negative thoughts, and she's not able to forget the person. The memory is attached, and along with that, she is going back to her childhood when she was abused. So even those thoughts are triggering, so getting triggered. So how to help this person? She was under medication and psychiatric help, but now she doesn't want to even go for that. So
I was just, why I'm opening this particular slide is for a particular reason. And if you look at this slide, oh, I'm so sorry. If you look at this particular side, to understand, if you look at the triggers, right, especially sexual abuse or changes in your life can trigger an underlying depression and anxiety. And if this person is suicidal, we must take it as a big warning and get the family involved, or get somebody close by involved, and take her back to her psychiatrist, whoever has been treating her. Because we as lay people you as lay people can give a lot of excuses of why she's feeling this way, right? You're feeling this way because of the breakup, you're feeling this way because of the sexual abuse, but we can't change those things. But we can empower her with the help of medications and therapy to handle this. We can't change the past sexual abuse, but we help her to process that trauma so that she's able to live with that trauma. She can't forget it, but we'll help her to process and deal with it. And the suicidal thoughts have to be taken care of with the help of medications.
she even tried to commit suicide several times. In fact, she'd taken pills and she was hospitalized, but almost she was about to die, but she obviously got saved her from there. So
yeah, so I think that shows the significance or the severity of her depression. So we probably need to be a little bit more serious about it. Yeah. I think some people have raised their hands.
Yes, Brother Peter Lewis, go ahead, and then Sridhar can hear.
Yeah, doctor, you said that all these problems are physical. That could be the case, but as a Christian, we also look at the spiritual angle of things. Like, Isaiah 61 said, the Spirit of the Lord God is upon me. He has anointed me to preach good tidings to the poor, set me to heal the brokenhearted, to proclaim liberty to the captives, and the opening of prison to those who are bound. Now, this is a scripture which Jesus came, and that in Luke chapter 4 says, and that was the very mandate of Jesus as a church.
Yeah, Brother Peter, this lecture is
no, that's fine. That's fine. That's
okay,
fine.
Go ahead.
Yeah.
Go ahead.
Yeah.
I'm not lecturing. What I'm saying is,
yes, sir.
I'm actually a prime minister with LL Ministries. We are in inner healing and deliverance. So
no, sir. What's your question? Sorry.
The question is, it's not just physical; it's also spiritual. So these problems like fear, suicidal, anger, these are a lot of spiritual issues. There are, when the person gets born again, okay, it's the spirit man is saved, but the soul needs setting free.
I think that's a topic that we could debate over another time, maybe
Yeah,
not
yeah.
in this forum,
Yeah, sure,
because
sure,
we'll be
sure, sure.
no. But I would just kind of want to talk a little bit about it, that there is no difference between a brain of a Christian or of a person of any other faith, right? And in the same way, if suppose I'm just kind of putting across a question, that suppose somebody from our community develops diabetes or develops hypertension, or even for the matter falls down and fracture the hand, at that time we are not going to quote Isaiah, we are going to take the person for help, right? So and that at that point of time we are not talking about it being a spiritual binding or a bondage. Then why the discrimination when it comes to mental health or depression? Why do we say that, okay, if you fall down and fracture your hand, it's a very, very genuine problem, but if you have depression, then it's because of a spiritual problem or because your faith is not very strong. And faith and hope are very, very important aspects of healing. I agree with you. And across research says that people who have faith, and faith in anything, it can be in anything, faith always do better when we intervene and when we give in medications and when we give therapy, because there is a positive attitude towards the change. But we have to look at it, brother, as a physical ailment. And I'm so happy that you raised this question, because it's so important for us to understand. And that's the whole purpose of this talk, to look at it as a physical ailment and not just the spiritual aspect. So if I'm physically unwell, if I'm sick and I'm having high fever, I'm not going to be able to feed my spiritual side. I will not be able to indulge in activities to improve my spiritual life. I will not be able to pray. I will not be able to do things because I'm having high fever. So at that time, I'm going to say, I'm going to take a crocin, I'm going to get my fever sorted, and then I'm going to feed my spiritual life. The same thing is with depression and anxiety. And it's very important that we identify that. And great leaders like you, I think you're going to be our ambassador now, I think the 45 people who are here, we are looking at you as mental health warriors and ambassadors who are going to go back into the community and probably change the narrative a little bit. I'm so happy that you attended this talk.
Right.
It was a lot of interesting stuff that you spoke about. And I do agree that it can be physical. We need mental health help and things like that. So very helpful. Thank you.
Yeah, okay. So, Brother
Can I
Sridhar,
ask one question?
uh,
Carry on,
Hands are
carry on.
raised, I
yeah,
think.
Sridhar is, yeah. Please raise your hand so we'll go according.
Normally,
Yeah.
normally anxiety is it a clinical problem? Sometimes I used to have anxiety for certain things, normally for news. So what will happen to now? Israel and Palestine war is happening. So I have anxiety to know the news and all. So is it a clinical issue?
No, sir. So anxiety as a symptom happens when our body is alert to some kind of danger. And that is our, as when we were hunters before, we had to be very, very alert to what kind of danger is happening, right? So our response to danger would be a fight or a flight response. So when we hear similar information which can threaten us in some way, then our response will be in that way. And if I have to run away from a situation, what happens after you run away? Your heartbeat is going to increase. You're going to have hands and legs which are paining. Your muscles are aching. You're feeling breathless. So an anxiety attack or anxiety thoughts happen when you're feeling in danger. It's not something to be concerned about if it happens in occasions and it goes away. But if it stays for a longer period of time, if it's impacting your regular activities, for example, I could be somebody who was anxious before every performance. So every time I have a talk, I will have a little bit of butterflies in my stomach. I'll feel a little anxious. I'll visit the washroom multiple times. Once I start my talk, I'm okay. Suppose I was not able to do the talk. Suppose this impacting my performance, then I need to intervene. Not if it's not causing any issues in my day-to-day life.
Okay, there are some questions in the chat as well. I think Sharon Kutty has asked, just like SNRIs help with depression and anxiety symptoms, is there any particular mode of psychotherapy which will tackle depression and anxiety together?
So, and there's a lot of data about psychotherapy also, which says that it causes changes in the brain when you practice it repeatedly, right? So in the same way, how medication, so the ideal situation for treatment is medications along with therapy together. How does therapy help? Therapy helps in unlearning some of the, wrong ways of how I have managed and coped with my life. And I learn how to correct that. I learn how to handle that situation better. But to do that, so it's like I gave you an example of the fracture. I fracture my hand. I will put in a plaster. I will wait for the bone to heal. And once the bone is healed, I may go for physiotherapy to make the muscle strong. In the same way, when you have depression, anxiety, you start medication, get your depression, anxiety in control, and if needed, then add in therapy to enhance the benefits and the effects.
Right. You are free to ask questions anonymously also. You could
I think Angelina has raised her hand.
Yeah, so send it directly to Dr. Sheryl or to me. Yeah. Okay, Angeline, go ahead, please.
Yeah, hi doctor. Thanks for the session. Yeah, I just wanted to ask regarding the menopausal women. I mean, because they're also going through immediate and high shifts in hormonal things, right? And especially, I'm asking this for a case where they're already predisposed to it, like taking thyroid pills for over a decade, having low
Yes,
deep.
I think I'm thanks so sorry. Thank you for raising that important aspect. I just missed about menopause. I spoke about postpartum because that gets missed a lot. Menopausal women, by the virtue of the hormonal changes that they're having, all our lives as women, and now, sorry, will I freeze?
Yeah.
Sorry, I'm so sorry. I think I just froze. So I said, thank you for raising that thing because I missed talking about menopausal women when I spoke about postpartum women. Women, when we achieve menopause, the protective benefits of a lot of our hormones go away. So we are much, much more vulnerable to develop depression and anxiety. So, and again, this is because a lot of times when women experience these symptoms, it's just pushed under the carpet. And we as women will say, oh, it's normal. All of us went through this. Menopause mein aise hi hota hai. You know, you'll go through this for some time. You suffer. We all suffered for 4-5 years and then we'll get better. There's no need to suffer. We just come and take help and it gets better. So yes, menopausal women do experience much, much more, the incidence and percentages more than other women.
Okay, yeah, please ask, raise your hands or put it on the chat. There's an anonymous question. Does coffee cause anxiety and depression? Does coffee cause anxiety?
I'm sorry, I can't hear you.
Okay, does coffee cause depression and anxiety? Coffee.
If you're predisposed to a problem, caffeine in any, it could be a Red Bull, it could be a coffee, it could be tea, can trigger an anxiety attack or cause you to feel restless. It cannot cause depression and anxiety, but if you're predisposed to anxiety, sometimes people who consume caffeine feel extremely restless.
Right. Okay. Yeah, Ishita, please go ahead. Ishita, okay. Okay, there's a question in the chat. What are the research gaps you have found in the area of depression and anxiety? Any suggestions?
I'm not sure.
Sharon Kutty, what are the research gaps you have found in the area of depressions and anxiety? Any suggestions about research gaps?
Sorry, Abhijit. I was not able to hear that.
Okay. What are the research gaps you have found in the area of depression and anxiety? Any suggestions?
I'm not very sure what the question means, but I think maybe what is saying that, so there is a lot of recent data and research which speaks about a lot of changes in the brain circuit. So earlier when we, can you hear me? I don't know if I'm just
we can hear you. We can hear you. Yeah. We can hear you.
Okay, sorry. Yeah, so it's earlier when I started psychiatry years ago, we would have compartments where we are talking about disorders, and now we know that brain is not a compartment; it's a fluid organ. with all the connections being there. So there's not research gaps. There are a lot of new data coming up and work being done on research and anxiety, which shows us more and more the physical aspect of depression and anxiety.
Okay.
Yeah, can I ask question?
Yes, yes. Go ahead.
Yeah,
Yes, Ishita.
yeah. In fact, you spoke about this chemical aspects which happen in the brain, and the lack of awareness. I mean, in fact, it's like more to know what is the reality, because in other ailments or problems, we always have something visible, I mean, telling us. For example, there is a what is it, a graph or a ECG, or some kind of an visible thing which doctors can say, and somebody historically also it can be maintained and proved, while when it comes to brain, like is MRI, or what is it, like, or what are
So
the
there are
basis of
a lot of research which say we can do a lot of brain scans, a PET scan, an MRI scan, a SPECT scan, which will pick up changes in the brain in depression, anxiety.
so are
But we
those things
usually do
done?
not advise those things because they're very, very expensive. And
Yeah.
when the diagnosis is very simple, there is no point of getting that done unless you want to kind of have a documentation for it. But and more research is coming up to show these changes in the brain images. We have an fMRI, functional MRI, not a plain MRI, because it's to do with the chemicals and the metabolism in the brain. We do a functional MRI to pick up that certain parts of the brain are not functioning as well and certain parts are functioning more.
Right. Can OCD be cured? Next question. Can OCD be cured?
Yeah. So OCD is one of the disorders. Yes. So OCD is one of the more serious psychiatric disorders, in the sense that I'm not talking about cure, but it can be very much controlled and maintained with medication. A lot of patients, depending on when you start treatment, we do see a lot of young adults, if they come for treatment right in the beginning, we give them medications for a few years, and there can be periods in time where they're completely off medication. But about 50 to 60% of people do need medications for a longer period of time. And we maintain them on medications.
Right. Can a person in depression and bipolar type 2 on medication go for hypnotherapy? Is it helpful?
So a person with bipolar mood disorder, we would not recommend hypnotherapy at all.
Okay. Doctor, there are many meditation and mindfulness techniques that are not so biblical. Can you please tell us as okay, this is more from the religious perspective, although this is no
So
more a pleasure.
any practice of mindfulness, and each religion has their own practices of mindfulness. What is the concept of mindfulness? Mindfulness means being in the present moment. And each religion, whether you're a Muslim, whether you're a Hindu, whether you're a Christian, your religion has some ways of promoting mindfulness. Muslims have beads, Hindus have beads, a lot of Christians have rosary. I'm just giving you an example. I'm not saying that you have to do any of these things. I'm just saying these are all practices of being mindful. So when you're sitting to practice mindfulness as a therapy, you can be mindful and you can meditate on the word of the God, or of a particular verse in the Bible that relates to you, and you can kind of keep on repeating that. If you belong to another religion, you can meditate on a prayer or a chant that you want to. Anything that you do. And mindfulness can be as simple as no religious background. I can just brush my teeth and be mindful. And I'll tell you how. How many of you know what is the taste of your toothpaste?
Mint.
Great. So he's mindful. That's why they keep on saying, na, aapke toothpaste mein namak hai ki nahi? Because you have to taste. We don't taste. We just put the paste, we brush and we gargle and we leave on getting on to our day. So mindfulness means being in the present moment. And then brushing teeth in the morning, if you're able to engage all our 5 senses, that means I'm seeing how it tastes, how it feels in my mouth, how the paste smells. That's a mindfulness exercise. So there is nothing that is unspiritual or not biblical about brushing our teeth. right? But every religion has their own mindfulness practices, and we should do what suits us the best. There is no right and wrong here.
Right, right. Okay. Okay, there are some more questions then on personal chat, which are anonymous, which is there some food to improve mental health? Particular food?
So a lot of food which has good omega-3 fatty acids, right? So omega-3 fatty acid supplements help a lot in depression and anxiety. And there's a lot of data and research about that too. So if you incorporate food which has omega-3 rich, which is fish oils, you're vegetarian, you can take diet or, supplements of omega-3, it's great. Any balanced diet, because you require fats, proteins, and carbohydrates for your brain neurotransmitters. So having a balanced diet, eating your food on time, maintaining sleep hygiene, being able to sleep on time will also help in promoting and improving your mental health.
What are the mental transformation good habits or practices, 21 days habits in bracket, that will help us shift from negativity to positivity? Please suggest or advise such steps.
So if you're not somebody who's having depression or anxiety and you want to focus on building up something, it's like I'm healthy, I'm fine, but I want to run the marathon in January. Right? I can't suddenly decide in January I'm going to go and run the marathon. I'll start training for it from today. In the same way, to build positive mental health, there are a lot of practices that we can do. Mindfulness is one practice. The second practice is a practice of gratitude. So there is a lot of research which says that gratitude practice activates a part of your brain which shrinks actually in depression. And again, every religion promotes gratitude as a practice. So we thank God for everything that happens to us. But when you're talking about gratitude as a practice, it's about maybe sitting together as a family every day, having a gratitude circle, and each person narrates one thing in the day that you have been grateful for. It cannot be, I'm grateful for my food, I'm grateful for my home. No, one particular experience of the day that you're grateful for. That is a great resilience or a positive mental health attitude. Experiences rather than investing in things. So experiencing in going out with your family to the park rather than buying the new PS5. Having that experience helps in building mental health. Savoring as a practice. So enjoying something that you're eating at that time and enjoying it without comparing it to something else. This is also a practice which helps in improving mental health. So gratitude, building resilience, an optimistic attitude towards life will help.
Okay, friends, we have come to the close of our session now. Any last one or two questions? We don't want to hold up Dr. Sheryl also. It's a weekday. Yeah. So unless we are done, then I think we are free to close. Is there anybody wanting to ask
Maybe
any questions?
if anybody has questions, they could probably also email it to you.
Right.
Sorry,
Yeah,
Right.
yes.
it's not a question, but it's just a thought which has come that because mental health requires so much of, awareness building. What are the initiatives that the profession or this fraternity is taking for policy initiatives at the workplace or, various other, forums? That would be very good to take up, perhaps.
So, ma'am, this is one of our initiatives, right? This whole aspect that we're doing this. I'm just one of the so many psychiatrists and mental health professionals, and we have great mental professionals. My psychology colleagues, my therapy colleagues, they're all doing great work in the mental health field. Whenever we get an opportunity, like I said, but we are very few in number. The number of
Correct.
psychiatrists and mental professionals is very small. That's why I said that the 50 of you in this room are now empowered to go out and act as our ambassadors. And every time you meet another person and you talk to them about how depression is a physical problem, how it's, there is no myth, you break the stigma, you talk more about it. And it's great because unless you talk and break the stigma, it becomes very difficult. I know that, if I go to a social gathering and if I see, let's say, 2 or 3 of my patients there, they would never want to come up and talk to me. They'll never come and tell me that this is my doctor.
Yeah.
Vis-a-vis, if I was a gynecologist, everybody would come and want to tell me and then bring their children also and say, okay, you delivered my baby. But even if you're a psychiatrist, I don't want to do that because of the stigma associated with it. So you and I will be, breaking the stigma when we go out and talk more and more about how it's not in your mind, how it's a physical problem.
So one more other thing is the parallel. Sorry, I'm taking one more minute of yours, but the parallel thing is how it's not just the person who's undergoing this trauma, but also the family members, how they respond to it, And there is
Very
no
much, very much.
education and awareness on that ground, and they don't have patience. And I think if adequately things are not done at that level, I think the overall effort kind of can be diluted. So something I think
But I'm looking at it in a very positive way, ma'am. Like I said, I've been practiced for almost 20 years now. In the beginning of my practice to now, and especially I think post-COVID, we're definitely seeing a lot of awareness, especially the young adults are very, very promising as compared to maybe oldies like me. The young adults come on their own. They want to seek care. They've read about an article about depression. They'll bring their parents along and say, I think I have depression. I think I have anxiety. Can you kind of talk to the doctor? And sometimes it may not be depression and anxiety, but they're ready to come and talk and evaluate and get it sorted. So there is a lot of hope, I think, and all of us together will build up this momentum.
Sure.
Right.
Definitely.
Okay.
Thank you.
Yeah. Okay. I think probably, ma'am, you've already mentioned this, but somebody's asked it again, and maybe it's good to underline that, is how can we as ambassadors take this collaboration forward? How do we move forward? What can we do on the ground?
So I think most of us now are aware about how somebody with depression can present with. So our understanding about suicide, what we should say and not, and every opportunity that you get, especially I think for the church leaders here, and an opportunity that you get and you're able to identify, because a lot of people, if you're counselors or your church leaders, you have a lot of people who come to you with their problems. Some of it may be spiritual concerns, but a majority of them would be mental health concerns. And if you are alert to this and say, okay, this is actually depression and anxiety, and refer them to the counselors in your parish or counselors, who are going to work with you. And then if they feel, okay, this person needs more intervention, and then go to a psychiatrist, it'll be great. So I think that's what we need to do as a community.
Okay. Yeah, thank you so much.
And a lot of activities are happening. We have the Mumbai Transformation Network, where there are a lot of trained counselors. We have YMCA, which is a lot of trained lay counselors who are ready to work with a lot of organizations so that we can, empower and strengthen the pastors and the spiritual leaders. So, we just help you to do your work in a better way and identify and help these people too.
Yeah. Okay. Thank you so much, Dr. Sheryl. Once again, from all of us, thank you for your burden, your commitment to this cause, and we really hope and pray that this will be something that we will carry forward as ambassadors, as you've said, and that we will also
Thank you so much for having me.
Yeah, people to come out of the closet, and we must, friends, be willing to talk about mental health in our families, in our circles, churches, society, communities, wherever you come from. And, because there's so many people suffering in silence, and, there's so much struggle. And so thank you, everyone. We greatly appreciate that you've joined. And be in touch. We'll keep you posted about the next part of the series. Yeah. Thank you. Good night, everyone.
Thank you.